Hi, I'm Dr. Raipudi from Gastro Office, and there's a common problem I see with a lot of, I'd say mostly female patients, something called costochondritis, and many people are not aware of it. And we as gastroenterologists get referred a lot of patients with atypical chest pain. What is atypical chest pain? It's not like the typical pain that you develop in the left side of the heart that goes down your left arm or into your thumb or goes up the left neck. Those are all symptoms of like a real heart pain or chest pain, or myocardial infarction is what we call it. It's something related to the heart or pain coming on with exertion. But this pain, atypical chest pain, can happen on the right side. It can happen here, it can happen somewhere in between the shoulder blades. It may present as burning only in the middle, or it can present on left side or all over the chest, but not usually worsened with exertion. And that is what we call atypical chest pain. So, atypical chest pain, we generally suspect something called GERD, G-E-R-D, which is gastroesophageal reflux disease. And then we manage patients for it, and if it's needed, we look inside with a scope, like pass a scope and look inside and diagnose if there's anything else going on with the patient's problem. So once, let's say, that workup is complete and patient is on acid pills and you still have pain here, so then what's the problem? So females have this issue. They say they have pain right here in the top part of the stomach or in the lower part of the chest. So it's mostly females, and they have pain in the top part of the stomach or lower part of the chest, and when they push on it, it causes pain. So, and also when they exert or lift heavy weights, these are usually young mothers. They lift their babies up or their kids up, or they're moving a heavy object at their home, and then they start to get this pain here. So the reason I've been saying female patients is because of the breast tissue, because you end up carrying the breast tissue, so it causes a lot of strain in that area, in the lower parts of the rib cage, and also in the sternum. So this is a picture, you can see here in this picture, there's a rib cage, and there's this little tongue-like structure, if you can see it, under the sternum, that's called the xiphoid process, and then there is this cartilage that attaches to the rib cage, and this cartilage can get inflamed. And so when it's inflamed, it causes pain, and that inflammation can come from the chronic tug on that area because of the excess weight or excessive straining. And that usually causes pain, which is mostly localized, doesn't go to the back, because sometimes pain here going straight through to the back is typical for pancreatitis pain. But this pain generally stays here, and if you push on it, it gets worse. By testing, usually by pushing on that local area and testing the rib cage, the margins, and knowing their history, etc., then it's very simple to treat it. It's mostly heat packs you put on that area to help heal up the pain, improve the circulation, and reduce the pain. And heat packs, muzzle rubs, anything topically like Bengay or sports sprays, muzzle rubs, anything will work. You put it on that area, and there's also a new cream that which is 1% Voltaren cream, which is available OTC. You can apply on that area, local area, and then avoid lifting heavy weights or babies, or avoid straining yourself carrying the weights overhead or even moving them. And in case of females, it's best to wear a sports bra to support the breast, so you're not letting that weight tug on this area, and get better. Or if there's a severe case of it, sometimes doctors use steroids to help for a very short duration. But most of the time it's recognizing extremely important to exclude other causes of chest pain. So we should not be neglecting the other causes, which is mostly heart attack or severe acid reflux or something related to the lungs or something related to the backbone. So these are all things that can give you pain anywhere in the chest. So you need to be careful. But one of the common issues we see, and then I talk to patients at the end of the workup, is costochondritis. And it's a simple condition that can be treated easily once it's recognized.